Hi, my name's David Kay from Dynamic Chiropractic at the Viaduct and Remuera. Slip disc, prolapsed disc, herniated disc, or a sequestered disc. What do these terms mean and what does it mean for you? Let's get straight into it. With a normal disc, we've got several key components. Firstly, we've got the nucleus, which if you could imagine your disc as a jelly donut or a jam donut, this is the jam in that donut. The second part is the annulus or the annulus fibrosus. Now this is a ring of connective tissue that encapsulates the nucleus. Now the disc is very, very pliable, and it also aids in holding the vertebrae or the bones of your spine together. And so these are very, very strong structures, but strong structures designed to move are susceptible to damage. The next part we've got to consider is the spinal cord that runs down the back of our spine through the spinal canal. Of course, we've got the spinal nerves, and these nerves here branch off the central spinal cord, and in the lumbar spine that's actually referred to as the quarter equina, because by that stage the nerve branches have already started to branch off even before leaving the spinal cord. And of course these all exit through what's called the foramina, or the foramen. Now the common afflictions associated with disc injuries are the back pain, the sciatica. Obviously we've got numbness. Occasionally you get the pins and needles into the legs. Quite often though you'll have somebody who comes up and they've got weakness, or they're having trouble standing. They might have foot drop, trouble walking. Anything they do is actually causing them discomfort and they can't get comfortable. That's very, very common. And in really extenuating circumstances, we can sometimes get bladder weakness and irritability of the bowel. The first thing we want to assess is, I guess if we do it a grade, how the disc is worn out. It might have been lifting, twisting, bending, could have been from coughing or sneezing. And we start to get some pressure put on back of the vertebrae here, and that starts to bulge out onto the spinal nerve root itself. Now that may not cause symptoms at this stage. In fact, there's a lot of people who would go through their entire lives with disc bulges without any symptoms ever being evident. You can see here that we've actually now got an increased size of that bulge. So the nucleus, the central part of the disc, is now starting to bulge further out through the fibers of the annulus, and it's putting pressure now onto that. So what we'll see here is the nucleus is starting to bulge through, and in fact it's nearly gone all the way through the annular fibers and extending all the way back through onto the spinal nerve root. So by the time it gets to this stage, there may be symptoms that are there more persistently. So they're there every time they roll over in bed, maybe getting out of a seat. The symptoms like pins and needles, they might be there. The weakness, everything we spoke about originally might be exacerbated by the presence of a nearly full thickness disc prolapse. You can see it here again, bulging straight through the annular fibers. Now, contrary to what this diagram shows, the disc itself does not empty out. If you squashed a jelly donut or a jam donut, it's going to decrease the actual size of the disc, and it's going to, I guess, press the jam, so to speak, out the side of the donut. And exactly the same thing holds true for a disc herniation. Now, if there's complete rupture, then there is not much you can do other than go in there surgically and remove that bulge. You can adjust it, as in seeing a chiropractor, which is what we do quite a lot of, or you can have spinal injections to hopefully reduce the size of that disc prolapse. But again, there's no guarantees with any of these approaches. The worst case scenario in this instance is really what's called sequestration of the disc, and that is where a part or fragment of the disc ruptures through the annulus and into the spinal cord itself. At this stage, your body is also quite adaptable, so it can go in there and mop this up over a period of 12 to 18, maybe even through to 2 years. So the diagnosis for disc injury is, whilst it's not a short-term diagnosis, it is not forever. However, the damage associated with nerve root impact can be forever. So it's very, very careful that if you've got these symptoms that you are having things looked at in a timely fashion. So hopefully you might know a little bit more about what happens with a disc prolapse, a disc bulge, or herniation and sequestration. And the slip disc itself doesn't actually exist, and it can't happen unless there's complete separation between the vertebrae and the intervertebral disc. We deal with it on a daily basis here at Dynamic Chiropractic. If it's something you have experienced or someone that you love and care about has experienced, watch this video with them. Share it with them and comment in the section below. Happy to answer any questions. If not, follow up us on www.dynamicchiro.co.nz, and we look forward to taking care of you when we get the opportunity.